Do you get calf tightness no matter how much you stretch before or after your run? Well, there may be 3 key reasons why that's happening. And to give you a clue, it's not more stretching or changing the type of stretching that you're doing. In this video, we're going to take you through 3 of the main reasons that we see people have consistently tight pain after they run or during their run, especially in the patients that we've seen in our clinic. So one of the key reasons that you might be getting tight calves after you run is that you don't have strong enough calves. So they may not have the strength capacity that they require to tolerate the amount of force that's put through your calf muscles when you run. So we know when you run, up to 7 times your body weight goes through your calf and Achilles muscle. So that's a huge amount of force, a huge amount of demand that's placed on your calf muscle every time you run. And the faster pace that you run at, the more demand that's placed on your Achilles tendon. So as you can see from the graph, if you're aged between 20 to 29, you should aim for 37 for males and 30 for females. And that moves slightly downwards as we get older. So the graph is useful for thinking about calf muscle capacity in terms of endurance capacity. So normally in clinic we ask our patients to try and do at least 25 single leg calf raises. As you can see in the video, it's slowly up and slowly back down again. It's really helpful to think about 3 seconds up and then 3 seconds down, and you're trying to go to complete failure. It doesn't count as a full repetition if you don't get all the way up as high as you can go. Then in terms of shorter distances, there's other things to consider. Ideally you want to get a calf capacity of 1.2 times your body weight. So that might be that you're doing a seated calf raise. This is one of the most traditional Slus raise exercises. Ideally from a strength perspective, you would do them 3 times a week to get the maximum benefit from the exercises. So in terms of how you'd structure your week, you might think about a run followed by strength work and then a rest day, and then repeat that in a cycle over the course of 10 days. Another reason that you might be getting tight calf muscles during and after your run is that you might have a Slus muscle tear. So as you can see from the image, we have 2 muscles in our calf complex. One is the gastrocnemius and one is the Slus. So the Slus is a long flat muscle that sits underneath the gastrocnemius. We know that it works primarily when your knee is slightly bent, but it does work throughout the gait cycle. A Slus tear presents itself slightly differently than a typical gastrocnemius tear. That usually occurs with high speed activity. So a classic symptom of that would be a tennis leg, where you go to sprint and you get a sudden pop in your leg. That's a classic sign of a gastrocnemius tear. However, with a Slus tear, what you normally feel is this dull ache or tightening sensation or cramping sensation as you run. It can gradually increase as you run further, and that's why some people think they're getting a cramp or they're getting this increased tightness and the calves become too tight to continue running, when in fact it's a Slus tear. These injuries normally benefit from a combination of rest from the activity while you strengthen it. You try to aim for the same strength capacity targets that we talked about earlier on, and in an ideal world you needed to become pain-free walking day to day. Then we usually progress patients onto double leg hopping, single leg hopping pain-free before they begin to return to run. As you can see from the graph, different activities place different stress on the calf and Achilles tendon. The final reason that our patients get tight calves when they're running is got to do with their running technique or with their footwear. So we group these together as normally they come hand in hand. So first things first, when we run, if we aim to have a high cadence, so that's the amount of steps that we take per minute, we should aim for ideally 171 to 180 or even higher. That reduces the amount of stress that's placed on the calf, normally shortens our stride length, and as a result it reduces the stress strain curve placed on the calf muscle, reducing the likelihood of fatigue and therefore tightening. When it comes to foot strike positioning, if we think about heel strike versus forefoot, what we know from our kinematic studies is that if you run with a more midfoot to forefoot strike, you're likely to put greater pressure through your calf muscle. It places greater demand on it, whereas if you heel strike, there's more demand on your other muscles such as your quadriceps. So that's something to consider in terms of your gait and how you move. Ideally we don't ask patients to change their gait cycle, but it just gives us an interpretation of how much demand they're placing on the calf muscle. So an easy solution to this might be that you change the type of training that you're running in, and the thing that we need to consider is the stack height. So as you can see from the image, it's got to do with the height difference from the back to the front of the shoe. The higher that is, we know that it reduces the stress placed on the calf as we run. So some shoes that we might think about are the New Balance 880s, or a lot of the Mizuno Wave collection. They have a 10 mil plus stack height, which is the back is 10 mils higher than the front, and this can be really helpful in offloading the calf muscle when you run, and that helps to reduce your muscle tightness overall. So hopefully this video helps clarify that no matter how much stretching you're doing, it won't make a difference if you've got a Slus tear, if your calf is not as strong as you might need it to be, or if parts of your gait or your shoes are influencing how much you overload your calf muscle. If you've got any questions, leave them in the comment section below, and if you found the video, please like and subscribe to our channel.